Breathing free is something that many of us might take for granted until you start having issues. If you do find yourself having sinus issues, know that you do not have to live with them. Joining us today to tell us about symptoms and solutions of chronic sinusitis is Dr. Wells from Columbia Breathe Free Sinus and Allergy Centers. Thanks so much for being here.
Thank you, Madeline. I'm excited to be here and talk about this problem that really affects people's lives and affects their quality of life significantly.
Overall, what is chronic sinusitis?
Yeah, it can mean a lot of different things to different people, but basically, chronic sinusitis is inflammation and often infection within the sinuses. We have 8 sets of sinuses. There's 4 on each side, and people can have sinusitis in all of those, or just one, or some combination. Most people have some combination, and some folks have all of them. But once in a while, you'll have somebody with just problem in one sinus. And what happens is the health of the sinus is determined by the doorway or the gateway in and out of that sinus. When it's open, the right size and shape, the sinus is happy. It can breathe and drain, and we don't even pay attention to our sinuses. Mm-hmm. When that opening gets blocked or narrowed, then things start to go wrong. So what happens then is the mucus can't circulate normally. The mucus becomes very thick and starts draining down our throat. We call it postnasal drainage. It's very acidic, so it's irritating to our throat. And it causes sore throat, can impact swallowing, can cause hoarseness, and certainly can cause cough.
What are some of the health impacts that sinuses can have on maybe other areas?
I think most people don't realize how impactful sinus is on our quality of life. So those kinds of impacts, you think about them from like sinus headaches. They can trigger migraines, which can be debilitating for folks. And when you've got a bad headache, it's really hard to function. That drainage, that can cause chronic cough, and people have a lot of sore throat. People with asthma have a terrible time if they have sinusitis because it worsens their asthma symptoms. So those can be a big impact. If we don't breathe well through our nose, it's very annoying. You don't exercise, or your athletic performance can be impaired. It really impacts your sleep. So if someone has to mouth breathe, they have dry mouth, it dries them out. That can have a big impact on the health of their teeth. It also leads to bad breath. And then it really impacts their sleep and the quality of their sleep. In fact, there are studies that show that up to 20 to 25% of patients with chronic sinusitis suffer from depression because their quality of life is so impaired. And so when we're able to identify what's going on and help these patients get those things cleared up, get them breathing right and sleeping well, they're so happy. It's very rewarding, and it's great to be able to do it with just simple treatments in the office.
So how might someone know that they're dealing with chronic sinusitis?
Yeah, so what we say is if you've got those hallmark symptoms of a lot of congestion in your nose, that thick, cloudy, colored drainage, a lot of pressure over the sinuses, sinus headaches, that drainage down your throat, or just not smelling very well, and that, again, that nasal obstruction, it's a high likelihood that you have chronic sinusitis. And a lot of people may say, well, I have allergies. Well, those two go hand in hand, and they're kind of hard to separate out from each other sometimes, but we can help them do that.
So when someone comes into the office and they have chronic sinusitis, what are some of the treatments that you recommend? Yeah,
so what we do is a lot of people will say, when do I know to come into the office? And what we tell folks is, if you've had these symptoms for more than a few months and you've had some antibiotics and either they just didn't help clear up your symptoms, or maybe they helped, but then in a month or so the symptoms were back, then it's time to come in and see us. You don't want to just keep taking antibiotics over and over. And so when you come to see us, we'll do a thorough evaluation, and we get it all done on the first visit. So number one, we can get you in the same day or within 24 hours, whenever you prefer to be seen. And we'll get your evaluation done right away, including a picture of your sinuses. So it's a simple sinus scan. You sit in a chair and the little device just moves around your head, got it in just a minute or two, but it shows your sinuses very detailed, and we'll go over that with you and show you what's going on. When we talk about how to treat these things, we certainly want to make sure that we've tried the simple medications, whether it's Flonase and decongestants, certainly antibiotics when appropriate, but we don't want to have patients continuing to take antibiotics over and over.
Right.
Those are two big concerns. The good news is we can resolve and eliminate chronic inflammation and chronic sinusitis by utilizing a very simple, safe technique called balloon sinuplasty or balloon sinus dilation. And what we do is we just slide in a little balloon catheter into that sinus opening that's blocked, and we can gently dilate it and get it back open again. So it's a procedure that's done very simply and safe in the office, so you don't have to go to the operating room with
Great.
all that's involved with that. You don't have to have general anesthesia, which has its own set of issues and risks, and it takes longer to recover from that. We can do it very simply in the office. We spray your nose with a decongestant and a numbing spray. We slide in little cotton strips with that same medication on it into the little sinus area, and that does a great job numbing things up and allows us to slide in that little tiny balloon catheter, and then that will gently dilate the sinus, and then we take the catheter back out, so we don't go home with the balloon in your nose.
Yeah.
It only takes about 4 or 5 seconds to dilate the sinus. Take it back out, and that gets your sinuses healthy. We're preserving all that anatomy and all that tissue, and because we're taking that approach, we don't have scarring like you do with a lot more invasive surgery, so that doorway stays open much better.
If someone's at home thinking, okay, these are some of the symptoms I have and I want to explore treatments maybe, or just see what's going on really, how can they get in touch?
They can reach us in a number of ways. They can call the number that we'll give them here at the end of this segment. They can look us up online and schedule an appointment right on our website. They can also go through something called ZocDoc. So multiple ways to reach us. And again, we'll get you in the same day or as soon as you're ready to be seen.
Yes, thank you so much, Dr. Wells.
Thanks, Madeline.
Great to see you as
Great to see
always,
you.
and we'll be back next week with more ways to breathe free.